Hello, I'm Dr. Paul Jeffords, an orthopedic spine surgeon at Resurgens Spine Center in Atlanta, Georgia. If you are someone who is suffering from back and leg pain from a degenerative disc and stenosis of the lumbar spine, and you have failed to improve with non-surgical treatment, you may be a candidate for a surgical procedure called a laminectomy infusion. There are two goals of this surgery. The first goal is to remove disc material, bone spurs, and overgrown ligaments that are pressing on the nerves that are exiting the spinal canal in your lower back to relieve radiating leg pain. This part of the procedure is called the laminectomy. The second goal is to stabilize the degenerated segments of the spine in order to reduce back pain and prevent recurrent leg pain. This part of the procedure is done by placing titanium screws into the bones of the spine and connecting them with rods. Bone graft is placed over the bones of the spine, and as it heals, the bones unite and become one. This is called a fusion. The screws and rods can be used to correct deformities of the spine, such as a spondylolisthesis or scoliosis. What I would like to do in this video is describe the surgical procedure, talk about what steps you will take in preparing for the surgery, what will happen during the operation, and what you can expect in your recovery. After you have been evaluated by your surgeon and it's been determined that you are in fact a surgical candidate, you will probably want to discuss next steps with your family and probably pursue a second opinion. Once you have made the decision to proceed with the surgery, the first thing you will want to do is to schedule a date for your preoperative consultation. It is during this session that you will have the chance to meet with your surgeon and staff, ask any questions you may have, and sign the consent form for surgery. At this time, you will be prescribed any medications for postoperative care and may undergo additional preoperative tests. This may include a chest X-ray, EKG, and blood work. You will check into the hospital or surgery center the morning of your surgery. Your anesthesiologist will bring you into the operating room and put you to sleep for the operation. There are usually 2 nurses in the OR and a surgical assistant helping your surgeon with the procedure. Once you have been positioned on the operating room table, face down, your surgeon will make a single incision in the middle of your lower back. For a single level fusion, the incision is typically between 3 and 5 inches in length. The muscle tissue overlying the spine is moved to the side, and retractors are placed to provide visualization for the surgeon during the procedure. At this point, the laminectomy is performed. The lamina is the bony arch that forms the roof of the spinal canal at each spinal level. Each of the lamina are connected by a ligament that runs just beneath the arches called the ligamentum flavum. Arthritis of the spine causes the lamina and the ligamentum flavum to become thickened, creating pressure on the spinal nerves. Arthritis also causes the spinal facet joints to enlarge and form bone spurs, which places additional pressure on the nerves. During a laminectomy, your surgeon will remove the portions of the lamina, ligamentum flavum, bone spurs, and facet joints that are pressing on the nerves. Any disc material pressing on the nerves will also be removed. Once the laminectomy is completed, your surgeon will perform the fusion. Titanium screws are placed into the vertebra to be fused through columns of bone called pedicles. The pedicle screws are connected on each side with titanium rods. Bone graft is then placed over the bones to allow the fusion to take place. The bone graft may include the bone that was removed during the laminectomy, and bone graft may also be taken from your pelvis through the same or a separate incision. Cadaver bone called allograft may also be used. Sometimes a T-lift is performed, where disc material between the vertebra is completely removed and a fusion cage filled with bone graft material is then placed into the disc space, restoring the natural height of the disc and providing stability as it fuses. At the completion of the procedure, a small drain may be placed in the incision to prevent any bloody drainage collecting at the incision site. If you have a drain, it will be removed before you leave the hospital. The incision is closed with resorbable stitches that are placed beneath the skin. A typical laminectomy infusion procedure can take anywhere from 2 to 5 hours, depending on the number of levels that need to be fused. Immediately after surgery, you will be taken to the recovery room for 1 to 2 hours while the anesthesia wears off and your vital signs are checked. Afterwards, you will be taken to your room where you can visit with your family. Your surgeon will speak to your family while you're in recovery and give them an update on your procedure and condition. The nurses will get you out of bed to walk either the same day of surgery or the following morning. You should be able to slowly climb stairs before going home. Most patients are able to go home the morning after surgery or the following day. Occasionally, some patients will stay an extra day. You may ride in a car or airplane upon your release from the hospital. You will be given pain medication and a muscle relaxant to help control postoperative pain and spasms. Please ensure that you do not drive or operate any heavy machinery while on this medication. Approximately 2 weeks after your surgery, You'll have a postoperative visit with your surgeon, and your wound will be checked. You may return to sedentary office or desk work 2 to 3 weeks after your procedure. If your job demands that you are involved in heavy lifting or frequent bending or climbing, you should wait 6 months before returning to this type of activity. You can return to moderate duty in 3 months. Typically, your surgeon will see you again to check on your recovery process 6 weeks after the surgery, and then again at 3 and 6 months. When you return for your post-op visits, an X-ray will be taken to check on your fusion. Complete fusion is usually seen to be solid at 6 months. You may resume sporting activities such as golf or tennis 6 months after your surgery, provided that the fusion is solid. As with any surgical procedure, there are inherent risks. There are 3 different categories of risks arising from the surgical procedure. There are risks associated with anesthesia, risk of complications that can happen during the operation, and risk of complications that can occur after surgery. Risks of anesthesia are rare in healthy patients, but may include the possibility of allergic reaction to medications, seizures, heart attack, stroke, or death. Risk of complications during the operation include risk of nerve injury and risk of injury to the nerve sac, which can cause a spinal fluid leak. The risk of these complications is around 1%. Finally, after the operation, there are complications that can occur. There is about a 1% risk of infection. Another risk after the surgery is the bone fusion not healing, which can lead to recurrent pain and possibly the need for further surgery. Even if the fusion heals perfectly, a small percentage of patients may continue to experience back or leg pain. You should talk to your surgeon about these risks. The laminectomy and fusion procedure is one of the most common surgical procedures performed today. Surgical intervention should always be the last resort, but when all other treatments have failed, this procedure can often provide significant relief of back and leg pain caused by stenosis, arthritis, and spinal instability. Thank you for taking the time to watch this video. You may have additional questions, and if so, you may want to consult with your surgeon.